Talking about vitamin B1, also known as thiamine. This essential nutrient plays a huge role in keeping our bodies running smoothly. But, what exactly does it do, and why is it so important? Let's break it down in simple terms. Vitamin B1 is like the spark plug in your car. It helps convert the food you eat into energy that your body can use. Without it, you'd feel like a car without gas, tired and sluggish. Thiamine is crucial for the health of your brain, nerves, and heart. But, here's the kicker, your body doesn't store it. So, you need to get a steady supply from your diet. Thiamine is water-soluble, which means it dissolves in water and isn't stored in your body. You need to consume it regularly through your diet. Or you need to get the benfotiamine. It is a more bioavailable form of B1 and has higher tissue penetration than thiamine. Studies have shown its antioxidant and anti-inflammatory potential in activated immune and glial cells. It also reduces complications observed in type 2 diabetes. Foods rich in thiamine include pork, trout, black beans, sunflower seeds, and fortified cereals. Even some commercial bread varieties are good sources. But, what happens if you don't get enough thiamine? Thiamine deficiency can lead to a range of health issues. The symptoms can be subtle at first, like fatigue and irritability. But if left unchecked, it can cause more severe problems like nerve damage, heart issues, and even paralysis. This condition is known as beriberi. Thiamine deficiency is rare in places where food is plentiful and supplements are available. But, it can still occur, especially in people with certain medical conditions or poor dietary habits. For example, individuals with alcohol dependence, eating disorders, or those who have undergone weight loss surgery are at higher risk. In some parts of the world, thiamine deficiency is more common. For instance, in Kashmir, where polished rice is a staple food, thiamine deficiency-related neuropathy is still prevalent. This condition causes weakness, especially in the lower limbs, and can be reversed with thiamine supplementation. Pregnant and breastfeeding women, as well as people with overactive thyroids, may also have higher thiamine needs. If you're in one of these groups, it's essential to ensure you're getting enough thiamine in your diet. So, how can you make sure you're getting enough thiamine? It's simple, eat a balanced diet that includes thiamine-rich foods. If you're concerned about your intake, consider taking a multivitamin that includes thiamine. And if you suspect you might have a deficiency, talk to your doctor. They can run tests and recommend the best course of action. Now, let's talk about some specific cases where thiamine deficiency can be particularly problematic. One such case is Wernicke-Korsakoff syndrome, a severe form of thiamine deficiency often seen in people with chronic alcohol use disorder. This condition affects the brain and can cause symptoms like confusion, memory loss, and difficulty walking. It's a serious condition that requires immediate medical attention and thiamine supplementation. Another interesting aspect of thiamine deficiency is its impact on the cardiovascular system. There are two types of beriberi, wet and dry. Wet beriberi affects the heart and circulatory system, leading to symptoms like shortness of breath, swelling in the legs, and rapid heartbeat. Dry beriberi, on the other hand, primarily affects the nervous system, causing numbness, tingling, and muscle weakness. In some cases, thiamine deficiency can also lead to peripheral neuropathy, a condition that affects the nerves outside the brain and spinal cord. This can cause symptoms like pain, tingling, and weakness in the hands and feet. Interestingly, a study found that elevated liver enzymes and fasting glucose levels were correlated with neuropathy in patients with alcohol use disorder, regardless of their blood thiamine levels. This suggests that other factors, like liver dysfunction and hyperglycemia, may also play a role in the development of neuropathy in these patients. Better forms of vitamin B1 for body. More bioavailable forms of vitamin B1: benfotiamine, thiamine pyrophosphate or TPP, and fursaltiamine. These forms offer enhanced absorption and effectiveness compared to regular thiamine. Let's start with benfotiamine. It's a synthetic derivative of thiamine that's fat-soluble. This means it can easily cross cell membranes and reach various tissues in our body. Benfotiamine has gained popularity due to its superior bioavailability compared to regular thiamine. When we take benfotiamine orally, it gets converted into thiamine in our body. But, here's the interesting part, it achieves much higher blood and tissue levels of thiamine compared to regular supplements. This makes it particularly useful for people with thiamine deficiency or those at risk of it. Benfotiamine has shown promise in several areas. It may help with diabetic complications by reducing the formation of harmful advanced glycation end products. It also has potential neuroprotective effects, which could be beneficial for brain health. Now, let's move on to thiamine pyrophosphate, or TPP for short. TPP is the active form of thiamine in our body. It's the form that actually works in various metabolic processes. When we consume regular thiamine, our body needs to convert it into TPP. But, with TPP supplements, we're getting the active form directly. This can be particularly helpful for people who have difficulty converting thiamine to TPP efficiently. TPP plays a crucial role in energy production. It's a key player in the conversion of carbohydrates into ATP, our body's energy currency. This makes it especially important for brain function, as our brain is a high-energy organ. TPP also supports heart health and may help with mood regulation. Some studies suggest it could be beneficial for stress relief and overall psychological well-being. Last but not least, let's talk about thiamine, also known as thiamine tetrahydroperipheral disulfide or TTFD. This is another fat-soluble form of thiamine that offers high bioavailability. Thiamine works a bit differently from the other forms. It can pass through cell membranes easily and then convert to thiamine inside the cells. This unique property allows it to achieve high intracellular thiamine levels. Research suggests that thiamine may have neuroprotective effects. It could potentially help with conditions like Alzheimer's disease and other forms of cognitive decline. Some studies have also explored its use in treating fatigue and improving athletic performance. Now, you might be wondering where you can find these forms of vitamin B1. Thiamine and TPP are available as supplements in many health food stores and online retailers. Thiamine is less common but can also be found in some specialty supplement stores. But, it's important to note that while these are more bioavailable forms of thiamine, they're not typically found in food sources. Regular thiamine, however, can be found in various foods. Good sources of thiamine include whole grains, legumes, nuts, and seeds. Pork and fish are also rich in thiamine. Some breakfast cereals and bread products are fortified with thiamine as well. When it comes to dosage, it's crucial to consult with a healthcare professional. The appropriate dose can vary depending on individual needs and health conditions. These more bioavailable forms are potent, so it's important to use them correctly. Each of these forms of vitamin B1 has its unique benefits. Thiamine shines in its ability to achieve high blood and tissue levels of thiamine. TPP offers the advantage of being the active form that our body uses directly. Thiamine stands out for its ability to achieve high intracellular thiamine levels. But, they all share the common goal of ensuring our body has enough thiamine to function optimally. Thiamine is crucial for energy production, nervous system function, and cardiovascular health. These advanced forms of vitamin B1 offer solutions for people who may have difficulty absorbing or utilizing regular thiamine effectively. They provide options for those looking to optimize their thiamine levels for various health goals. For instance, athletes might be interested in these forms for their potential to support energy production and performance. People with diabetes might find thiamine particularly interesting for its potential to help with diabetic complications. Those concerned about brain health and cognitive function might be drawn to the neuroprotective potential of these forms, particularly thiamine. And individuals dealing with chronic fatigue might find the energy-supporting properties of TPP appealing. But, it's not just about addressing deficiencies or specific health concerns. Even for generally healthy individuals, these forms of vitamin B1 could offer a way to support overall health and well-being. They might help ensure optimal thiamine levels, which could translate to better energy levels, improved mood, and enhanced cognitive function. But, as always, it's important to approach supplementation thoughtfully and under professional guidance. It's worth noting that while these forms offer enhanced bioavailability, they're not necessarily better for everyone in all situations. Regular thiamine still has its place and works well for many people. The choice between regular thiamine and these more bioavailable forms often depends on individual needs, health status, and goals. A healthcare professional can help determine which form might be most appropriate for you. As research continues, we're likely to learn even more about these advanced forms of vitamin B1. They represent an exciting development in nutrition science, offering new ways to support our health through optimized nutrient absorption and utilization. But, while supplements can be beneficial, they're not a replacement for a balanced diet. It's always important to focus on getting nutrients from whole foods as much as possible, and use supplements as just that, supplements to an already healthy diet and lifestyle. As we wrap up, let's recap the key points. Thiamine, thiamine pyrophosphate, and thiamine are more bioavailable forms of vitamin B1. They offer enhanced absorption and effectiveness compared to regular thiamine. Thiamine is fat-soluble and achieves high blood and tissue levels of thiamine. Thiamine pyrophosphate is the active form of thiamine that our body uses directly. Thiamine can achieve high intracellular thiamine levels. These forms have shown potential benefits for energy production, brain health, cardiovascular function, and more. But, they should be used thoughtfully and under professional guidance. Thank you for joining us on this exploration of advanced vitamin B1 forms. We hope you found this information helpful and interesting. Stay curious about your health and nutrition, and keep learning. So, what can you do to prevent thiamine deficiency? Here are a few tips. Eat a variety of thiamine-rich foods, such as green leafy vegetables, pork, most fish like salmon, black beans, most other legumes, green soybeans with 60% ADV, mung beans, soybeans, sunflower seeds, and fortified cereals. If you're at risk of deficiency, consider taking a multivitamin that includes thiamine. Avoid excessive alcohol consumption, as it can interfere with thiamine absorption and increase your risk of deficiency. If you have a medical condition that affects your thiamine levels, work with your doctor to manage it and ensure you're getting enough of this essential nutrient. In conclusion, thiamine is a vital nutrient that plays a crucial role in converting food into energy and maintaining the health of your brain, nerves, and heart. While thiamine deficiency is rare in places with access to a variety of foods and supplements, it's still important to be aware of the symptoms and risk factors. By eating a balanced diet and taking steps to prevent deficiency, you can help ensure your body gets the thiamine it needs to function at its best.